Hello, this is Dr. Tina right here. I hope you all are doing well and thank you for being with me here today. So, about a month ago or two, I discussed with you about COVID-19 vaccine. Yes, by God's grace today, I had my shot done over here. So, let me tell you everything. I have been there before, but I freaked out and came home. And I gave myself some time to read more about COVID-19 vaccine, side effects. I also listened to other people that have already taken the vaccine to ask about their experiences. It seems like all of them mentioned the side effects and they were similar as I compared various answers. And so I prepared my mind towards it. And I determined that this vaccine is better than getting the COVID-19 itself. So I made it a point that I will go get the vaccine. So yesterday I went and made an appointment, which would have been next week. But I wanted today, but this is the strategy I used. I wanted to take these shots on my days off. Off days that maybe I have 2-3 days. So I look at my schedule and I realize I'll be off today, Saturday, and Sunday, which will give me room so that even if I will experience any side effects, I'll be in the house and I'll be able to take care of myself. I realized that whenever you take even vaccine, sometimes you can run fever and all those kind of stuff. So on my way to work, at work last night, I packed out certain things like Motrin or Tylenol, some vitamins that I picked with me. I have zinc diluted, is the tablet you put in water. So I got all these things. And I made sure last night I took my vitamin and I took some of these medications and I went to work. So this morning I walked over there and I asked them, is it possible that I will get a chance for the vaccine today? They handed me an application form and I filled it out and they said, follow this line. So I was the third person. Fortunately or unfortunately, one lady that was the first lady left, and so it became the second one. And we checked in after about 30 minutes. So my nurse was very nice and we talked and she gave me the opportunity to even video, which I forgot to push the play.
Forgot to push
So
record.
I had the video, some video, but she was done. That I took one picture which wasn't also clear. To be honest, I was a little anxious, a little bit, but my mind was made up that this is the time to take the vaccine. Because come to think of it, I work closely with a lot of people, a lot of patients. I see patients. The kind of work I do, I work around patients. So your probability of being exposed to this kind of illness or the pandemic is very high. So I took the bold step to just get a vaccine as a preventative, so that even if you are exposed, your immune system will be stronger to fight such illnesses, or the way you will fall sick, it would be so severe as compared to somebody without the vaccine. So which I made up my mind and did it. So after getting the shots, they gave me a small card which they have the next dose date. So in about 21 days or 2 weeks, you'll be able to go take the next vaccine. So I took this vaccine at around 8:30, and I was done about 8:40. I had to wait in a waiting room with a lot of people, but we were social distancing, and they would check the card to see if the date for the next dose is appropriately dated. So I had the Pfizer. Usually I wanted the Moderna because most people that I work with in the clinic had the Moderna, and they were like, they didn't have any signs or symptoms or side effects. So in my mind, it was made up to take Moderna. But the first time I went there and I found out it wasn't Moderna but Pfizer, I started freaking out. That was how I came home. But this time I had read a little bit, listened, and also done my own investigation. So I went and had it. Yay! So I waited we were supposed to wait for 15 minutes, but I waited about 20 minutes because I was waiting on them for the return of my cards because they were verifying. And so when they brought me my card, so when they gave me the shot, I didn't actually feel like some stains or something like that. There wasn't any stain, but you could feel the needle going into your skin, which is normal feeling. And then after a while, as I was in the waiting room, I felt little soreness around. So I quickly, after I left, I went to my car and waited about 5 to 10 minutes. I bought something I can eat, so I sat in the car and I ate, and then I took some vitamins and Motrin before driving home. And I came home, I just took a quick hot shower and then slept, and I just woke up, but I don't feel anything over there. Maybe when I touch, but I don't even realize where I got a shot. So today is the first day. Let's see what goes on. So I'm urging you that yes, it's better, always better to take vaccine compared to getting the disease itself, because you don't know how you're going to do. I have friends that have testified that they had the disease and it was really horrible. It's affected their lungs and heart, and they went through a lot. Some even had to stay out of work for months. And so I will urge you that if you get the opportunity to have the shot, go do it. Don't wait, because the first time I went in there to get the shot, it was easy. They would be like, oh, be here, yeah, you can even apply if you don't have the schedule. But this time it wasn't like that, because there's so many people getting the shot, and so they take people according to the number of shots they have that day. So when you have the opportunity, do not wait. So this is the first day. I will post the vaccine, some of the video, even though she was done, but I had some shot, so I will post it with this video. So for now, I don't have any side effects, and I believe because I took all those medications. So when you are going to get your shots, make sure you eat. So after eating, make sure you take your vitamins. You take Tylenol or ibuprofen or Motrin, and then you take some zinc, all those kind of stuff that will help boost your immune system and then prevent you from getting fever and all those side effects. You can do that before getting the shot. I hope this helps, and I'm glad I had it. When I had the shot, I was jubilating. Yay, I had it. My nurse was also jubilating. Yay! But I didn't capture all that on the video. So go out there, don't be scared. We are all trying to get this pandemic out of the way, and so that it will cut the number of deaths and the sicknesses and deteriorating illnesses that people go through. And so side effects comes with everything. You could have side effects afterwards, but these are some of the things you can do to reduce some of the side effects. I remember when I started giving birth, anytime I take my baby to get a shot, I give them Tylenol. And when I go, they tell me, oh, she might have some fever and all that. They never did, because I did all that. So also do that. Drink enough water to stay hydrated. Wear your mask, because that is the first preventative action you can take. So don't go into places that you are not supposed to. Be mindful of where you are, social distance, and make sure you take your vitamins, you take ibuprofen or Tylenol something before getting the shot. I hope this helps. Again, this is Dr. Tina. Remember to subscribe to my channel, hit the like button, and share. May God be with you as you decide to go take this vaccine. I love you. Stay blessed. God bless you.
Give him pussy. I did it. Oh my gosh. I made it. Second day after shot, and I don't feel anything, any side effects. The site is sore when I touch. It's not swollen, but it's just sore. So that's the second day. Doing good.